The Complete Guide to Staying Safe After Your COVID Vaccine, Part 2. Question 8. Will you test positive for COVID-19 after getting the vaccine? No, because the vaccines do not contain the COVID-19 virus. All of the current vaccines work by teaching your body to fight against the protein that coats the outside of the COVID-19 virus. Your body does produce copies of that protein and builds immunity to that, but you're not replicating copies of the actual virus itself. Therefore, getting the vaccine will not cause you to get a positive COVID-19 test. However, since you do create antibodies that help you fight COVID, you may get a positive result on a COVID-19 antibody test. Question 9. Do I need a COVID-19 test if I'm vaccinated? In most cases, you'll only need to be tested if you show symptoms. Even if you're exposed to COVID-19, you likely don't have to worry about quarantining or taking a COVID-19 test if you don't feel sick. However, if you do start to show any symptoms, you should quarantine and visit a COVID-19 testing site, just like you would if you weren't vaccinated. One exception to this is if you live in a group setting, like a group home or a correctional facility. In that case, if you're exposed to COVID-19, you should get tested and quarantined for 14 days. Question 10. Will the vaccines work against new variants of COVID-19? They're probably effective against most COVID-19 variants. It's still too early to know for sure, but early evidence shows that the current vaccines will likely protect people against a wide variety of COVID-19 strains. However, the vaccines may not protect against all types of COVID-19. Some variants, like the B.1.351 strain that emerged from South Africa, show some resistance to antibodies and vaccines. Question 11. What are the most common side effects of the COVID-19 vaccine? You might have flu-like symptoms or soreness in your arm. When you get the vaccine, your immune system kicks into high gear. That can give you mild flu-like symptoms. You might feel tired or get a headache, muscle pains, a fever, or chills. You might also get pain, redness, or swelling in your arm where you received the shot. Some people develop a red, itchy, or sore rash on their arm after getting the vaccine. This can show up anywhere from a few days to more than a week after the shot, but it usually clears up in just a few days. Very rarely, some people have a severe allergic reaction to one of the vaccines. Most vaccine providers will have you stay on site for 15 to 30 minutes after you get the shot to make sure this doesn't happen. Question 12. How can I reduce the side effects of the COVID-19 vaccine? Ask your doctor about OTC medicines for discomfort. Most of the side effects of the COVID-19 vaccine are mild and will go away in a few days. Over-the-counter pain relievers like ibuprofen, aspirin, or acetaminophen can help with that. If you get a fever, drink plenty of water and dress in cool clothing until your temperature comes down. If you get an itchy or painful rash on the area where you got the shot, you can take an antihistamine or a pain reliever. You can also place a clean, wet cloth over the area to help ease any pain. Call your doctor if your side effects become worse after a few days. If you think you're having a severe allergic reaction, call emergency medical services immediately. Question 13. Should I get the second shot if I have an allergic reaction? If you have a severe allergic reaction or you react with hives, wheezing, or swelling within 4 hours of getting the first shot, don't get a second shot of the vaccine. If you had an allergic reaction to one of the mRNA vaccines, either Moderna or Pfizer, don't get the other mRNA vaccine. A severe reaction is one that had to be treated with epinephrine or in a hospital. If you had a reaction to the first dose of an mRNA vaccine and you can't complete your second dose, talk to your doctor about whether you need to get the non-mRNA vaccine, Johnson & Johnson, in order to be fully protected. It's okay to get the second shot if you develop a rash. If you noticed an itchy or swollen rash at the injection site, you might be concerned about getting a second shot. Fortunately, there's no evidence that this will lead to a severe reaction when you get the second dose of your vaccine. However, do tell the person who gives you your vaccine about it. They might advise you to get the shot in your other arm just to be safe.